Meniscal transplant surgery is very intuitively appealing. You've lost part of your meniscus, you think, I need to get a new one. Well, it's not so simple. If it worked perfectly and it was an easy operation, I think it would be that simple. But the simple fact of the matter is that in order to get a meniscal transplant, you really have to lose your whole meniscus. And so the younger you are and the more normal your knee is otherwise, if you've lost the whole function of your meniscus, then that would put you in the category of considering a meniscus transplant. Say, 18-year-old kid, I would say the most common indication would be a lateral meniscus. Often the lateral meniscus will tear serially over time and wind up having 2 or 3 scopes, and it winds up being either completely resected or losing most of its function. And then the surfaces over there can start wearing out. You know, if you take the meniscus out in a canine model in a dog, within 6 months it's bone on bone. The dog's knee does not tolerate that. The human knee tolerates it, but you can start developing wear. And so in very young kids, we start thinking about meniscus transplant, but only really when they've lost all the function of their meniscus. It's not a great operation to do in the middle of someone's athletic career because playing sports with a meniscus transplant increases the failure rate of that. There's a fairly high reoperation rate with it. A lot of times the need for a transplant might be associated with a ligament reconstruction or revision, ACL reconstruction as well. So those cases tend to be the more complicated knees. There are knees that are isolated meniscus deficiencies that need a meniscus transplant. I would say that the more common scenario is there's a lot else going on and a meniscus transplant is kind of part of it.